Hello, MGT 610 students. This is Dr. D. Marinas, and I wanted to give you a video to talk a little bit about your SMACs and what kind of projects you'll ultimately be creating. So here is your home page that you land on when you go into Canvas, and we click on modules. We go down, you'll now notice that there's a new module called Sample SMACs. So I put 3 of them in here. I could certainly talk about more if you'd like, but let's just look at these, make a general comment. So what I'm encouraging people to do in the past, or my students in the past, is to look at maybe some aspect of their work that they are doing, and if they have any access to data that they can really use. So in this particular case, I had a student who worked at South Oaks Hospital, and they were part of a conglomerate of hospitals. Zucker Hillside Hospital was another one that was part of that conglomerate. And our goal was to compare the food services scores between these 2 hospitals. So what you have here is looking at the finished product, the actual Smac that was created. And what these people decided to do, this pair of people decided to do something called a 2 proportion z-test. And that is one of the statistical tools that you'll learn about in this course. There's a video for it explaining it later on. We haven't learned about it yet. But what 2 proportion z-tests do is give you a nice way to compare the percentage of people who say yes in one group to the percentage of people who say yes in another group. So this is some background about the food services departments in their respective hospitals and how they operate and so forth. And ultimately what these people did was they had 2 proportions, and you can see them right here. I'll highlight them. They said let P1 be the proportion of patients that rate the quality of food at the top box for South Oaks Hospital for 2021 specifically. And then P2, the second proportion, was proportion of patients that rate the quality of food at top box. Top box would be the highest rating, by the way, for 2021 and Zucker Hillside Hospital. Now, there's a bunch of statistical tools that follow. This was some handwritten stuff and so forth. And at the end, they find something called a p-value, and they decide if they're going to rule in favor of their hypothesis or not. You'll notice right here, this is what they were thinking about. They were saying that maybe there's no difference in the hypotheses. That's what P1 minus P2 equals 0 means. It means that there's no difference between them. The 2 hospitals perform at the same level. Versus HA, P1 minus P2 is greater than 0, meaning that the proportion hospital 1 was higher. That was South Oaks, just to remind you. And when they were done, they were able to conclude that South Oaks Hospital did have a higher proportion, or I should say a significantly higher proportion of people who checked the top box than Zucker Hillside did. And so that will, this was sort of a neat project for them because these people suspected that they were doing a better job than the other hospital. And I would imagine some of you work in places where data is collected, and when it's collected, it might be used to assess you or a program that you're a part of or something like that. And this was just something that could show that they were doing a very good job. Also, at the end of the SMAC, you'll notice there's some references and other things, and as well as some comments about future studies and things like that. Okay, so I will do a video for a different SMAC, and you can watch that separately.